Hey guys, my name is Laura. I'm a board certified nurse practitioner and also a student of clinical anatomy. And I wanted to start sharing some of what I learned in my neuroanatomy class with you guys because I think this is extremely relevant to aesthetics and to anybody who works with the face. Today, I want to talk about the facial sensation and all about the trigeminal nerve because as we are familiar, or at least should be familiar with cranial nerve 7, right, which is your facial nerve, because every time you ask your patient to frown, to raise your brows, smile, or animate, you're actually assessing cranial nerve 7 and you're activating that facial nerve. So now I want to talk about sensory nerve of the face, which is cranial nerve 5, and that is your trigeminal nerve. Every time a patient feels touch, pressure, pain when you're sticking them in the face with a Botox needle or cannulating them, doing filler, that sensation is traveling from the trigeminal nerve into the brain. Now, let's take a look at this diagram. As you can see, the trigeminal nerve is cranial nerve 5, and this is a main sensory nerve of the face. There are 3 major branches that divide into 3 sensory nerves. I'm going to talk about the first branch all the way at the top, which is V1, and this is your ophthalmic branch of the trigeminal nerve. This covers sensation to the forehead, the scalp, around your eyes. Then we get into the maxillary branch, which is V2, and this covers the mid-face, cheeks, nose, and upper lip. All right, and as we descend, we hit the mandibular branch of the trigeminal nerve, which is V3, and this covers the lower face, the jawline, the chin, and parts of your tongue. But here's a pearl. V3 is actually both sensory and motor. It gives sensation to the lower face, but it also controls the muscles of mastication, like your masseter muscle and your temporalis muscle. So every time we treat the masseter muscle with Botox, we're actually affecting the motor component of V3. And every time we inject the chin or the jawline, we're working around these sensory branches. So essentially, every region of the face that we treat in aesthetics is innervated by one of these cranial nerves. One sensation is picked up from the face, right? You stick somebody in the face with a needle. It travels through the trigeminal nerve into the brainstem. It then crosses over and then ascends to the thalamus and then into the sensory cortex. This is where the brain actually perceives sensation. This is where we have like full consciousness, like, ouch, that hurt. So anytime a patient feels pain, pressure, numbness, tingling, there's actually an entire neurological pathway that is behind that. And for me, this isn't just academic. I work with faces every day, and I like to share the knowledge that I learn or anything that I know. I like to put it out there. So knowing where sensation travels, where the nerves run, and how the brain processes facial input is extremely important for safety, technique, and recognizing complications early. I hope this video was helpful, and follow me for more anatomy videos.